Dear students, myself I am Dr. Kalyani. Now we will be discussing about emetics and drugs which are used as anti-emetics. Before going to the topic, let us understand what is emesis. This emesis is also termed as vomiting. It is expulsion of contents from the oral tract, that is from the mouth. It is because of easy expulsion which could be triggering of the activities with respect to the emetic center. Generally, those drugs which are used to induce emesis or vomiting, those are called as emetics, and the drugs which are used to reduce the vomiting or which are used to control the vomiting or emesis, those drugs are called as anti-emetic drugs. Generally, these anti-emetic drugs will be triggering the vomiting center which is in connection with the cerebral cortex, and they will block the emetic center, thereby the emesis will be reduced. Generally, this emesis is a reflex which is in connection with both stomach as well as intestinal, that is specifically small intestinal linings. Whenever a patient is having emesis, it could be because of autonomic reflex or it could be because of triggering of the somatic cavities. So, which may be a combination of autonomic as well as somatic reflex. Now, let us understand what could be the causes or the agents which could be responsible for producing the emesis. Emesis could be because of chronic intake of alcohol, which is also because of alcoholism, or it could be because of usage of certain drugs like carbamazepine derivatives, or it could be because of excessive use of NSAIDs, non-steroidal anti-inflammatory drugs. It also could be because of infections which could be affecting the gastrointestinal system, or it could be UTI infections, that is urinary tract infections, or cystic fibrosis, or any of these conditions may also result in emesis. It could be also because of certain metabolic disorders like cysts which are associated with the GIT, or it could be because of the internal bleeding which could be in connection with the gastrointestinal disorders. So in certain cases of GERD, gastroesophageal reflux disorder, also we can see emesis. In certain diseases like Addison's disease as well as in ketoacidosis, we can see there is a phenomenon of emesis in patients who are undergoing any of these type of metabolic disorders, or it could be because of the internal or excessive usage of certain drugs, or it could be because of the derivatives of sometimes maybe because of dust or heavy exposure or continuous exposure of certain chemicals. Let's say certain persons who are working in the chemical industries, when they are exposed, let's say a patient is working in a pesticide industry, or a patient who is working in a pharmaceutical industry where there is higher reactivity chemicals, and exposure to these chemicals for a long period of time may also trigger these centers, vomiting centers, and may cause emesis. And continuous exposure to some certain noxious chemicals, gases also leads to phenomenon of emesis. Let us understand how the emesis pathway takes place. So in this emesis pathway, we will discuss internally what is happening here. So this is a phenomenon which is in connection with CNS. Whenever the cortex is activated, that means this cortex get activated either because of certain type of smells, pain may activate the cortex, or changes in the sight or vision may activate this cortex, or certain stimuli which are associated with psychogenic stimuli, these may trigger the cortex and they stimulate the cortex, which further stimulates the vomiting center in the brain. When this vomiting center is further activated by cerebellum because of the vestibular apparatus. We all know that vestibular apparatus is in connection with motion. So when there is any disturbance in the motion or movement, it could be because of vestibular imbalance which is in connection with vestibular apparatus. This triggers the cerebellum in the brain, and this further activates the vomiting center, resulting in emesis. In vomiting center, we have muscarinic receptors, that is M receptors, as well as histamine H1 receptors. So when these muscarinic receptors are activated, they will be activated further in connection with CTZ, chemoreceptor zone. CTZ, the full form of CTZ is chemoreceptor zone. Whenever this chemoreceptor zone is activated. This could be because of further activation of muscarinic receptors, and they also are in connection with 5-HT3, 5-hydroxytryptamine derivative. So these 5-hydroxytryptamine are further activated because whenever the blood vessels, activation of blood vessels is taking place, the constriction which is involved in the blood vessel may trigger the release of 5-HT3, and these 5-HT3 again in combination with other receptors like M1 receptors as well as D2 receptors and the combination of H1 receptors may further trigger the activation of CTZ, which could ultimately trigger the muscarinic receptors in the vomiting center, thereby affecting the cortex. This will cause emesis. In the other way, whenever emesis is induced by stimulation of the GIT, in GIT we have the 5-HT3 receptors. This 5-HT3 receptors also stimulate the D2 receptors which are present in the chemoreceptor trigger zone. At the same time, the GIT related 5-HT3 receptors may get connected with the STN 5-HT3 receptors which are present in the blood brain barrier. Activation of these 5-HT3 in STN will further activate the vomiting center, thereby resulting in a phenomenon called as emesis. So this entire sequence of reactions either may takes place because of activation of CTZ or because of activation of STN. Majorly blood vessels, when blood vessels are involved, there will be activation of CTZ. That means these blood vessels will be connected with CTZ, which is in connection again with vomiting center. And at the same time, if at all GIT is activated through a peripheral activation, this will trigger the 5-HT3. This is the second pathway where GIT related 5-HT3 is activated, which will further activate the STN, and this STN which will further activate the vomiting center, again resulting in emesis. Ultimately, this emesis pathway could be either triggered by any of the either ways. So generally, whenever drugs, excessive usage of drugs, or when a patient is exposed to radiation for a long period of time, or because of gastric irritation, majorly the second pathway will be triggered. However, the first pathway could be triggered because of excessive exposure to the chemicals, and patients who are involved in the long period of working in the pesticide industry, as well as in some cases the paint industry, people who are exposed to long period of time with the paint could be also have this CTZ activation resulting in emesis. Further understand what is the mechanism involved in emesis. The neurotransmitters which could trigger the emesis may involve acetylcholine, dopamine, 5-HT, and in majority of the cases this histamine is more related along with 5-HT3 in emesis. So generally, when a patient or a person is exposed to these type of chemicals or odors, or it could be emotional distress, or in some cases travel for a long period of time, or it could be because of GIT disturbance or distress. So any of these neurotransmitters could be further increased, which may result in emesis.